So it was on Wednesday this week that Quebec became the first province to allow a person with a serious and incurable illness to request that a medically assisted death be administered months, even years into the future. So in other words, before their condition might leave them unable to consent to that procedure, which is the way it is right now. We talked about this. I asked listeners what they thought about the new rules, good, bad, and different, and received, among others, these two completely different takes on this issue. Listen to this.
Most people don't want to die. They're afraid to suffer. They're afraid to be a burden. We need to have more education. It's not true that dying with dignity means having euthanasia. The movement has hijacked the term dignity. Dignity is to be human, is to be surrounded by family and caregivers that can alleviate your every symptom, whether it be physical or psychological. Canada and now Quebec is making a mess of this whole MAID movement. Doctors are actually offering it to people before even exploring all the options. It borders on unethical. Imagine the vulnerable patient who doesn't want to suffer, whose doctor is actually presenting this as an option because it's been made so widely available now in our province and in our country.
So that take against it, clearly, was followed by this.
I'm all for it because my father's currently going through this. He's 84 years old. Outside of his dementia, he's very strong, physical, his heart is good, the rest of his body is good. But as his dementia was developing, he lived in paranoia. He thought everybody was stealing from him. It was very scary. And I know he's a proud man. And he then said he didn't want to live that way and was very afraid of where he was going. He's not of sound mind to make the decision anymore. So now he has to go along for the ride. I wish I could do more for him. He made comments when I was younger, push me into a pool or just do something. But I can't do that. I wish I could. I would. But it's not an option for me. And it's terrible to watch him suffer.
Two very different views of this new rule, advanced chance to use medical assistance in dying. Dr. Catherine Ferrier is an assistant professor of family medicine at McGill, and she's a board member of the Living with Dignity group and is on the line. Dr. Ferrier, thank you for being here. I read the original piece. It seems to me, I don't want to put words in your mouth, you are not happy with this decision?
I'm not happy with this decision.
Why?
I think the first woman that you just played gave a lot of good reasons, and that's about MAID up to now. But now it's a question of when you're diagnosed with, say, Alzheimer's disease or another kind of dementia, you can sign a paper saying, when I'm incompetent in the future, I want you to euthanize me. And I think that is actually a fiction that's real consent. You're basically going to be ending the life of people who cannot give consent at the time that you're doing it. They signed a paper years back. They've changed over time. Their views have changed over time. They had no idea what things would be like. Informed consent means that you know all of the pros and cons and the details of what's been offered to you in medicine. And you can't do that 5-10 years in advance. It's just not possible.
I asked the question of Dr. L'Esperance, who we also had on the air, who's been spearheading a movement to get this done, and now finally it is done. And I asked him the question, I said, and maybe this is unfair, to what you just said about we don't know what's going to happen down the road in 5 or 10 years, how someone may feel, how their opinions might have changed. And I said, there's a possibility medical science, as amazing as it is, can come up, if not with a cure, certainly with perhaps a treatment. And what would happen in a case like that? And he said, look, 10 years, 15 years, 20 years, that's simply not going to happen based on what we know today. I'm not sure how you can look into a crystal ball and say that, but that does seem to be the view.
Well, science has not made a lot of progress in treatments for Alzheimer's disease, for example, which is the main thing that is on the table here. But Dr. L'Esperance also says that everybody is suffering when they have dementia, whether they seem to be suffering or not. And I don't know on what he bases that, because that's not my experience at all. I work with people with dementia. I work in the geriatric clinic, and that's what I do every day. And Dr. L'Esperance is a surgeon. So I don't know where he gets that data from, that he says people are always suffering. I don't think that that's the case at all.
Do you think, going forward here, and the thing that really struck me, and I'm sure living, or working in this field, we already have more people in this province who take medical assistance in dying to end their lives in bigger numbers than any place else. I point this out again, in the entire world. So it's not as if it's that difficult to get this now. Are you worried that this just makes it too easy?
Well, the Quebec government finally a few months ago started to think, how come we're the world champions in MAID? And they commissioned some research to find out why the world champions in MAID. And I mean, I could have told them many things. One is that it's being marketed to the public all the time. Another is that there's like no healthcare environment where you can escape from it. It's true what the woman said, that it's proposed to people. And the other thing is that people are afraid the healthcare system is in such a big mess that people are afraid that they won't get treated properly. But then you're ending people's lives because of a societal problem because we can't look after them. And I mean, I don't think that that's worthy of Canada in the 21st century. We should be able to do much, much better than that.
You know, I also, when I brought up the idea, we also had another woman who works in the palliative care system suggest exactly what the first woman did, the one I played back. Yeah. And when I brought it up, I started receiving text messages from people saying, well, you know what, in theory, that's all well and good. You can get great palliative care. The problem is I can't get a parent or grandparent even into palliative care to begin with.
That's right. Access to palliative care is a huge problem. You know, geriatric care and palliative care are not exactly the same thing, right? So geriatric care is somebody long-term who does not, well, anyway, dementia is a terminal illness, but over several years. Palliative care traditionally is thought of people with short-term terminal illness, like the palliative care ward at the Royal Victoria Hospital, places like St. Rayfield's, Mount Sinai. That's palliative care in the traditional sense. There's far less than is needed. There was a statistic, I don't know if it's still valid, that 70% of people in Canada who need palliative care will not get it. But that's again so the government's putting all this effort into pushing medical aid in dying when they're not offering the care that people need. And, you know, my patients, they go to the emergency room and they're there for 2, 3, 4 days on a stretcher in the hallway. You know, nobody wants to live that way, right? And you think, well, when I have dementia, I won't be able to fight for my rights. Even without dementia, you can't fight for your rights very well when you're sick. But I think we've been desensitized to the idea of what a momentous thing it is to end somebody's life. These last 10 years have made people kind of think it's normal. But if you step back and think, wow, you know, we're ending somebody's life. And in this situation with this new law, you're ending somebody's life who's not asking for it.
Maybe it's an unfair question to ask. I mean, I'm hearing what you're saying. We took calls yesterday. Some people agree. You heard that gentleman about his particular dad. I mean, that's a terrible situation as well. Is there a solution here? If there is, what is it?
Well, you know, there's a lot of things that we do for people with dementia. That's what we've been doing in my clinic for 40 years, you know, and we give medication. They're not so great, but it's better than nothing. But we do lots of other things. Like he said, his father had paranoia. There's ways of addressing paranoia, both non-pharmacologic ways and medication to address the paranoia. I was actually this morning talking to the son of one of my patients who we had a bit of a time over the last year or so because she was agitated and restless and not doing too well. And we did strategies and we did medication. And he told me today, he said, you know, I've never seen my mother in such a good mood. When I was young, she was like a harsh mother. And then we had this little kind of episode when she in her dementia. And now, like, she's always giving me compliments. And her face lights up when I come into the room and she thanks me and she's like another person. And she has like moderate to severe dementia, this woman. So the idea that it's, you know, unmitigated suffering is just not true.
I mean, clearly, when we talk about the fact, and you just said that, you know, that you can't, people who want to get into palliative care can't even necessarily get in, even if that was a way they wanted to extend their life. Yeah. What has to happen for as far as is the government simply ignoring this, not spending enough money doing this? What's the issue here?
Well, you know, when the MAID law came in 2015, it was promoted as like a law to improve end-of-life care, including palliative care. And then MAID kind of took over, right? So MAID was all over the place. Improving access and whatever. And the palliative care thing, like access to palliative care is not really improved in the last 10 years. So, and, you know, at the MUHC, there are fewer beds than there were a short time ago. It's like a way of cutting, I'm not blaming the hospital now, I'm just talking in general in the province, but it's seen as kind of, you know, it's not the high-tech stuff that people will give money for and so on and so forth. A lot of people misunderstand palliative care. They think that it's just kind of holding your hand until you die. But there's actually so much expertise to make sure that you don't suffer, that you ease your pain, ease your other symptoms, your psychological, your spiritual, like the whole thing. That's what palliative care does. It's also done in the home. It's like amazing. But, you know, they can get people out to pay for, you know, new cancer treatments a lot more easily than for palliative care. But the government doesn't. It needs to invest for sure.
Just as a final question, do you worry now that this advanced medical assistance in dying is the rule, the regulation, if you will?
Yeah.
Are you worried that more and more people take advantage of this, not fully knowing what you just described?
Absolutely. And I think, I see a lot of patients like signing papers that they don't really understand. I see it all the time. And I can see them doing the same thing with this, basically you say, I'd rather be dead than have dementia, which, is not a surprising thing for people to say. But within that, it's saying, in my life when I have dementia. It's like not the same thing. One is kind of just a statement, and the other is a wish that you're expressing. But I can see people signing those forms, for sure. Absolutely, and especially since it's being marked. I actually got an email from one of the hospitals I'm involved with saying, expect a lot of requests because this has been marketed so aggressively. And I didn't expect a hospital to say that, but that's what they said. That's what they want. Yeah.
Dr. Ferrier, I want to thank you for your time. Really appreciate it. Thanks so much.
Thank you.